All right. Mark has just arrived to the Care Campus for detox.
Hello. Are you here for detox?
Yeah, I'm ready.
Alright, so we will be requiring a rapid COVID test as well as a negative result. Are you okay with that?
Yes.
Okay.
So as long as Mark is okay with a rapid negative test, we can move on to the assessments. So at this time, Mark would stay outside and wait for Mo2. So if you are the tech, you will go inside radio to Mo2 for support, and Mo2 will come outside to conduct all normal assessments. Please complete the ROI as normal and provide that information to Mo2 to conduct their assessments. Once Mark passes all of his assessments, he will move to the COVID-19 rapid test station located outside of CIU.
Alright, Mike, have a seat. At this time, I will be completing the screening form.
Jessica will complete the screening form, which will have the client's name, date of birth, and a location to list the test number. The test number is listed on the front of the test box. So the test number also needs to be listed on that form. As you can see, Jessica is filling out the form on the tray, and that form will stay on the tray as the test itself will be laid on top of the form to confirm the name. The Mo2 staff member will begin to prep the COVID-19 test. To prep that test, the Mo2 staff member will open the package with the test itself and lay it flat with the pink side down on the test paper. The Mo2 staff member will now remove the droplets and add 6 drops to the top well of the test itself. Be sure not to touch the tip of the dropper to the test.
They're not easy to squeeze.
Now the Mo2 staff member will open the swab and hand the swab over to the client. The instructions that will be given to the client will be that they will be conducting their own nasal swab. They will remove their masks and insert the entire soft tip of the swab about 3/4 of an inch into the nose. Using medium pressure, rub the swab against the inside walls of your nostril and make 5 big circles. Count to 15 for the client. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now the client will be instructed to put the swab in the other nostril. Same thing, 15 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
All right, now he will hand the swab to the nurse, and the mask will be provided back on the client's face. The nurse will insert the swab in the bottom section of the test and rotate the swab to the right 3 times. Leave the swab in the card for the remainder of the test and peel off the adhesive liner. Close the test. And the tech will now note the time of the completion of the test. The test can be read exactly 15 minutes.
Okay.
At this time, the entire tray that the paper and test are resting on will be taken inside the building. Do not handle the test itself with your hands, but again, take the entire tray inside.
We'll be right back.
The client will remain outside to wait for the results. All our papers are flying away. The client will remain outside to wait for the results of the test. If the client is unable to complete the test on themselves, Motu is able to provide assistance in actually conducting the rapid test. Motu will need to use full PPE, including gown and mask. As a reminder, all staff should be wearing gloves, eye protection, and an N95.
Test result negative.
So at exactly 15 minutes, the test result will be read. If you look into the well of the test, one line for control means that the test is accurate, and no line under sample means that the test is negative. If you see a line under sample, even if it is a faint line, that is considered a positive test. So negative result will be documented on the rapid COVID screening form, and the test will be discarded into the biohazard bin. At this time, the tech can go out and get the client and bring him into the CIU lobby. Your test result was negative. You ready to go? So at this time, we would need to disinfect the entire space. The table and the chairs need to be wiped and cleaned between every client. So all of the information for the test is included in this binder, including a step-by-step procedure. Inside the front leaflet of the binder is the rapid COVID-19 screening forms, and in the binder itself are all of the steps that we went through today. So if you literally can read each step as you go through, and if you have any questions, refer back to this binder. Once the rapid screening form is completed, the completed document will be placed into this back sleeve. Please remember that once you've completed this, the information is logged into Care Manager for all clients under problems. If you have any questions, check with program supervisor or management. Thank you.
Client's test is negative and he's good to come for intake. So we'll create a new episode. Come detox, the assigned date. Client status would be assigned for now. Source, we'll just say Care Bernalillo. Okay, once that created, we'll go down to problems. Go to new problem. And for COVID positive, you'll click on the SARS-CoV antibody test positive. The date of the test, of course, the date that it was recorded. The problem type would be physical. Severity we'll keep as unknown. And the status will just keep active if they're positive, okay? And then you'll save and close. If the client is negative, you'll do the same thing. New problem, COVID negative. Same thing, SARS-CoV-2 antibody test negative. Date identified, the 19th. Date recorded. Problem type, physical. Severity is unknown. And status is active. And then save and close.